Welcome to the module on loss, grief, and trauma, developed by the Center for Advanced Studies in Child Welfare at the University of Minnesota, in partnership with the University of Vermont Department of Social Work. By the end of this module, participants will be able to 1. Understand basic brain development, 2. Identify differences between acute trauma, chronic trauma, and complex trauma, 3. Understand the way trauma impacts children's brain development, 4. Identify the 7 core issues in adoption and how they affect adopted children, adoptive families, and birth families. 5. Understand the concept of ambiguous loss and how it relates to permanency and adoption. 6. Identify factors that support resilience for children with traumatic histories. Welcome to the module on loss, grief, and trauma. Today we'll focus on how trauma impacts the brain development of children and adolescents, and permanency and adoption stability for children and their families. We will also learn about the 7 core issues in adoption and a specifically relevant type of loss called ambiguous loss. Research has connected adult health outcomes to childhood experiences. The Adverse Childhood Experiences Study, ACEs, found that the adverse childhood experiences correlate directly with poor adult health outcomes. Therefore, it is important to think about permanency through a trauma-informed lens to understand the way trauma influences child development, including brain development. It is also important to remember that children have resilience and strengths, even while experiencing trauma and other adverse childhood experiences. The fundamentals of the human brain are a good place to begin. Different parts of the brain control and regulate systems, and more sophisticated functions are regulated by the most forefront part of the brain, the cortex. The limbic system regulates emotions, behavior, and memory. The hippocampus regulates memory, in particular helping to retrieve or recall the what, where, and when of experiences. The amygdala controls emotions, attention, and concentration, and the ability to recognize facial clues, being able to read and interpret what other people are feeling through their facial expressions. The amygdala also plays a big role in forming nonverbal experiences that inform mental models. It also controls our fear response, flight, fight, or freeze. In this video, Daniel Siegel explains the brain and how it functions. The brain responds to past experiences and the mental models that have formed. Have you ever been surprised by a sudden emotional trigger, perhaps anger or anxiety, or extreme defensiveness, without knowing the origin of the reaction? Daniel Siegel says this occurs when the unconscious brain recalls a mental model that was pre-verbally formed, and because we didn't have words to verbally or abstractly understand this memory, the brain stored it as a nonverbal or sensory memory. The American Psychological Association defines trauma as an emotional response to a terrible event. Long-term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms. The National Child Traumatic Stress Network describes 2 types of traumatic events: acute traumatic events, chronic traumatic situations. Acute traumatic events are when a child experiences a serious injury or witnesses someone else's serious injury or death. A child may experience trauma around an imminent threat of injury or death to themselves or others. Acute traumatic events are typically one-time or short-lived events occurring in a particular time and place. Acute traumatic events include physical assault, including sexual assault, the violent loss or injury of a family member or friend, serious accidents, such as an automobile accident, mass shootings, such as in school, natural disasters, such as tornadoes, earthquakes, or floods, terrorist attacks. Chronic traumatic situations might take place over a longer period of time or occur repeatedly. Chronic traumatic events include repeated physical and sexual abuse, domestic violence, war and other forms of political violence, prolonged exposure to community violence. As more about trauma is learned from research, practitioners have become sensitive to the impact on children's development when exposed to multiple or prolonged traumatic events. The term complex trauma describes the developmental harm resulting from child maltreatment, including physical, sexual, and psychological abuse, domestic violence, and neglect. Factors that play a role in trauma include the type of trauma the child experienced, who perpetrated the trauma, for example, if the person inflicting the trauma is a parent or caregiver versus stranger, the age of the child when the trauma occurred or began, the child's temperament. A child's experiences of trauma affect his or her permanency and adoption adjustments. Traumatic experiences can detrimentally impact a child's ability to self-regulate emotions, self-regulate sleeping, eating, and other physiological functions, such as toileting, feel secure about attaching to parents and caregivers, learn in school. Children experiencing acute, chronic, or complex trauma often develop adaptive skills that are used to survive. However, these survival skills often work against successful permanency and adoption placements, particularly when parents and caregivers expect the child to drop those survival skills and return to normal. Many people think of adoption as a singular event. However, while an adoption finalization is a discrete moment, adoption impacts adopted persons and their birth and adoptive families for a lifetime, and can even affect multiple generations. Deborah Silverstein and JaeRan Kim highlight 7 core issues that are relevant to all members of the adoption constellation, particularly for the adopted person, birth parents, and adoptive parents. 1. Loss. 2. Rejection. 3. Guilt or shame. 4. Grief. 5. Identity. 6. Intimacy. 7. Mastery or control. Those impacted by adoption are likely to experience these issues in some way. It is important to remember that everyone will feel these core issues differently. Some in the adoption constellation may feel a certain issue resonates more strongly than others. As adoption is a lifelong process, at different phases of life, some of these core issues may be felt more strongly than at other times. It is normal, not pathological, for these issues to be present, and are expected challenges given the nature of adoption. Acknowledging these core issues allows for healing and the development of healthy coping strategies. The first core issue is loss. Adoption at its core involves loss. Although adoption is celebrated in our culture as a happy event, not every aspect of adoption is joyful. A child is unable to join an adoptive family without first experiencing the loss of his or her family of origin. A child loses their connections and relationship with their biological parents, and a parent loses their connection and relationship with their biological child. Even when the child is adopted into a loving, stable family, that placement does not erase or make up for other losses the child has experienced. Those who adopt as a result of infertility or loss of a biological child also frequently experience loss. Adopted children experience many other losses. Adopted children often lose their first and almost always their last birth name. Many children lose biological siblings and extended relatives. Older children lose schools, teachers, neighborhoods, and church or faith communities. Children adopted transracially or internationally lose being part of a racial and cultural family and community that shares their physical features, language, food, traditions, and culture. The experience of loss may make other normative losses in life more difficult to resolve. Adopted persons may have difficulty letting things go, or have a hard time with transitions, such as the end of a school year, or a new teacher, or moving to a new home. The losses involved in adoption are often unfortunately minimized to focus on the gains, invalidating or obstructing the important grieving process that is needed. Adopted persons do not quickly forget what has been taken away from their experience, and it is important to acknowledge the losses that are inherent in adoption. The second core issue is rejection. Adoption involves both real and perceived rejection. An adopted child often wonders what was wrong with them to cause their adoption, which can cause hypervigilance for fear that their adoptive parents will reject them as well if they don't live up to expectations. Adopted persons often become very sensitive to rejection, which may result in clingy behaviors, anticipation of rejection, and misunderstanding feedback or criticism as outright rejection. Adopted persons may also reject others to avoid having to deal with the potential rejection by others. Birth parents, particularly birth mothers, often felt rejection from their families, friends, and society at large for being in the position to relinquish a child for adoption. Adoptive parents are often anxious that they may be rejected by their adopted child. If their child expresses interest in searching for or having a relationship with their birth family, adoptive parents may feel the child is rejecting them as real parents. Guilt and shame is another core issue in adoption. Guilt and shame are tied closely to rejection. Adopted persons often perceive they are the reason for the losses and rejection that occur in an adoption, because they were unexpected, perhaps, or because the abuse or neglect they experienced caused them to come to the attention of Child Protective Services. In some cases, with internationally adopted children, the adopted child might feel they were born the wrong gender or were an economic burden to their birth family. Birth parents may feel a great deal of shame about an unplanned pregnancy or their inability to raise their child. Adoptive parents may feel shame that their family was not formed the way they intended if they were unable to have children biologically. The fourth core issue in adoption is grief. Grief is a byproduct of loss. When people are separated from loved ones through death, their grief is acknowledged and supported by family, community, and by society. However, grieving the losses that are a result of adoption are often minimized and misunderstood. Adopted children are often expected to feel lucky and grateful for being adopted, which does not offer space to grieve and mourn the loss of their birth family. This is particularly common when the child was removed from their birth family because of abuse or neglect. Birth parents may grieve the loss of their child as well as the loss of their status. For example, how do they acknowledge the child they placed for adoption when asked if they have children? Many parents who adopted due to infertility may not acknowledge or express their grief about the infertility. While adoption provides the opportunity to become a parent, it does not cure infertility. For some adoptive parents, their child may not be the dream child they expected, and these parents may grieve the fantasy or the dream of what they thought parenting through adoption would be like. The fifth core issue in adoption is identity. How one defines who they are and to whom they feel they belong are integral aspects of identity. A great deal of identity development is related to family, as they provide us with roles, responsibilities, history, culture, and values. As Silverstein and Kaplan state, identity is defined both by what one is and what one is not. An adopted person often feels tension around what parts of them are from the birth family and which parts are from the adoptive family, and also may feel a split between identifying with birth and adoptive families. This might be more pronounced if the adopted child differs from the adoptive family in physical appearance, temperament and personality, hobbies, interests, and talents. For example, an adopted child who is artistic in an adoptive family that is athletic may identify with a birth parent that is also artistic. Transracial adoptees may express a desire to resemble their adoptive family more, so that they do not look out of place within the family. Adopted persons that do not have access to medical information or birth family history may feel as if large parts of their identity are missing. Birth parents may struggle with their identity as they reconcile their socially unrecognized role in their child's life. Adoptive parents may struggle with feeling as if they are the real parents, particularly if they adopted a child that looks different from them physically. Intimacy is the sixth core issue in adoption. Humans are relational and crave interpersonal relationships with others. Adoption may impact the relationship development skills of members in the adoption kinship network. Intimacy not only impacts romantic relationships, but also peer and family relationships. Adopted children, based on a fear of rejection, may be overly rejecting of relationships, perhaps because they do not want to lose another relationship. Fear of losing relationships may lead to clingy, emotionally possessive, or anxious relationship behaviors. Adopted adolescents may engage in harmful sexual or peer relationships if this lends them a sense of belonging. The last core issue in adoption is mastery and control. Adopted children feel a lack of control about major life decisions that were made on their behalf. Adopted children have little or no control over the events that led up to their relinquishment, and with few exceptions, have very little control over their adoption. Adopted children may behave in over-controlling ways as a way to compensate for their feelings of powerlessness over their lives. They may also engage in power struggles with authority figures and parents. Some adopted children are passive and have difficulty feeling entitled to any control over their lives. An adopted teenager may be influenced by peer pressure, feeling as if they just need to do what others say or behave in passive-aggressive ways. Adopted children may exhibit perfectionistic tendencies and have difficulty engaging in activities in which they feel they cannot master or excel. It is important that professionals working with adoptive and birth families understand these 7 core issues and how they impact members of the adoption kinship network. While most of this discussion focused on the impact of these 7 core issues on adopted children and adolescents, they resonate with birth and adoptive parents as well. There will be further information on the impact of the 7 core issues on adoptive and birth parents at the end of the training. Loss, as previously discussed, is one of the 7 core issues in an adoption. Ambiguous loss is a specific type lacking clear endings or boundaries, often because there is a lack of socially recognized rituals to acknowledge or grieve the loss. Dr. Pauline Boss developed the theory of ambiguous loss to describe the pain families experience when their loved ones were missing in action due to war. When families were uncertain whether their loved one was alive or had died, it affected their ability to grieve that loss. There are 2 types of ambiguous loss. One type is when a person is physically missing but psychologically present in thought and memory. A loved one missing in action is one example of this type of ambiguous loss, and others include displacement of family members due to divorce or the kidnapping of a family member. The second type of ambiguous loss is when a person is physically present but psychologically unavailable. Examples of this type of ambiguous loss might be if a loved one is unable to be responsive because of drug or substance addiction or due to mental illness. Unlike other losses, ambiguous losses often lack a defined social ritual to honor and mark the loss, contributing to ambiguity and lack of resolution. For example, if a parent loses a child through death, a funeral marks that loss. A parent who loses a child through adoption is often told they are better off and should go on with their life. Similarly, a child who grieves for a parent lost through death is offered compassion, while a child who grieves a biological parent who placed them for adoption is expected to be grateful for being adopted. Even if the adopted child or individual was adopted at birth, they may feel ambiguous loss if they worry and wonder about their biological parents. This may especially be true if the adoption was closed and there is very little information about the birth parents. Professionals working with adoptive or foster parents, biological parents, and adopted children and individuals can help their clients by explaining and normalizing ambiguous loss, and helping them create rituals that may ease ambiguity. Some rituals that might be helpful for adopted children and other members of the adopted constellation include some of the following activities. Helping the child create a loss box, in which they can place mementos, photos, drawings, or other items that symbolize their losses. The child can then have a parent or therapist keep the box in a safe place. The child can visit the box at their instigation when they feel the need to remember what was lost. This helps the child understand their losses are acknowledged and validated, and gives them permission to grieve. Another option is acknowledging important dates that have meaning to the child, such as birth parent birthdays or adoption placement dates. Some parents celebrate Gotcha Day, but not all children feel that as a happy day. It is important to acknowledge that the day the child's adoption was finalized may be a day of mixed emotions for a child, and allow the child to have mixed emotions on their placement day. Acknowledging birth parents, birth siblings, or former foster families during holidays by hanging an ornament on the Christmas tree or lighting a candle in remembrance of family members not present. A ritual that incorporates other family members who are not present allows the child to acknowledge the loss of their birth family without singling them out. Finally, using books and television shows to talk about how characters felt and grieved over their losses. A few examples include Harry Potter and Anne of Green Gables. This module has discussed brain development in children and the impact of trauma on a child's adjustment to permanency and adoption. We learned about the 7 core issues in adoption that impact adopted children and adolescents, adoptive parents, and birth parents. We also learned about the concept of ambiguous loss, how it is experienced by members of the Adoption Kinship Network experience, and ways in which professionals can help families understand and develop coping strategies to address ambiguous loss. John Bowlby stated that children are better able to resolve losses appropriately when the following needs are met. The child experiences a reasonably secure relationship with the person who is leaving or gone. The child receives prompt, accurate information about what has happened. The child is allowed to participate in the grieving process, both publicly and privately, and the child has a relationship with a trusted adult who can comfort and provide a continuous relationship. When considering the impact of trauma on brain development and attachment, it is also important to consider ways that children are resilient and how professionals can help increase resilience in children that have experienced foster care and adoption. As a final reflection, it is helpful to think about how our current permanency and adoption practices follow the model suggested by Dr. Bowlby. Are there ways that our own practices could implement these suggestions to decrease loss and improve the well-being of children in foster and adoptive placements? More information on many of the topics covered today can be referenced in the resource list. Thank you for participating in today's module on adoption and permanency.